Hey. Oh, selling. Walozia. How long time? Long time. All right. This is Dr. Chain Akano. Once again, President, Founder, the Timothy Akano Foundation. Good evening. I hope you guys are all right and have had a wonderful weekend so far. Looking forward to the Monday tomorrow and the bustling week. Like you know, our topic for today is cervical cancer. Cervical cancer, that is cancer of the cervix. I don't want to assume that everybody here knows what the cervix is. So I would explain what the cervix is, at least. Second, cervix is the opening into the womb, into the uterus. If anybody here who has had a baby would have heard in the labor room that the cervix is dilating. So it's the cervix that opens up to 10 centimeters for the head of your baby to come out during delivery. So that is the cervix. And this is what turns into cancer, and then you obviously have cancer of the cervix that we're going to be talking about today. So having known what the cervix is, obviously we know what cancer is. So we're going to talk about just a little epidemiology, a little fact about, the cancer. It is, like in the UK, is the second most common cancer after ovarian cancer in the woman, but worldwide is the second most common cancer in the women after breast cancer. Second most common. So it's very common. It's not a very rapidly developing cancer. It's a cancer that develops slowly. It is a cancer that has a course. It's a cancer that can be prevented. It's a cancer that can be cured. And it's a cancer that has screening program that if you follow them, your chances of developing cancer is low. So it's a cancer that we know what causes it. It is a cancer we can prevent. It is a cancer that if you're careful, your chances of developing it is very, very low. It is commoner, though it is said to be more common in women of about 52 years, but it's also seen a lot in women between 20 and 35. The problem is that in those women who are younger, the prognosis is worse. So what it means is that outcome of the cancer is worse in those younger women. So you can have this cancer of the cervix in any woman, from 20 and above, but it's commoner in women of age of 52. So you can see it in younger ages. So very common cancer. It has a cause. So let's talk about what causes the cancer. Most cancers do not have a cause. Nobody knows what causes them. But this cervical cancer is one cancer that we know what causes it. At least 99% of all cases of cervical cancer is caused by a virus known as human papilloma virus, HPV. This virus has about 100 strains of it. Most of them don't cause anything, but there's a strain called 15, 18, 33. These kind of 3 strains are the ones that cause cervical cancer. It is a sexually transmitted infection. HPV is a sexually transmitted infection. You can get the infection through oral sex, anal sex, vaginal sex. You can also get it through exchange of sex toys. If somebody who's got the infection exchanges their sex toys with another person, you can have it. You can also have it if there's skin-to-skin contact during sex. So it's a sexual infection. In fact, most people would have this infection in their lifetime. It affects both men and women. So it's not just a woman infection. So this infection can cause a lot of problems. A lot of problems. It can cause a sexually transmitted infection we call genital wart, which is like a lump around your vagina or your penis. It can cause cancer of the cervix, like we're going to be talking about. It can cause cancer of the vagina. It can cause cancer of the vulva. It can cause cancer of the penis. It can cause cancer of the throat. It can cause cancer of the mouth. This virus, you can see how dangerous it is. It can cause all these factors, yet it is preventable. So this is HPV, human papilloma virus, causes this cancer of the cervix, among other cancers that it causes, and other sexual infection that it causes. So it is a very important infection. Most people, like I said, would have it in their lifetime, this HPV. But it's not everybody that has HPV that does have problems. So you can have HPV without any problems. Okay, so I'm going to talk about eventually how to prevent HPV and what it does. This HPV, just know that there is no symptom of HPV. It is the infection that it causes, or the problem that it causes, that has symptoms. So you can say, oh, what are the symptoms of HPV? There are no symptoms. You can ask me, what is the treatment of HPV? There is no treatment of that virus. But you can deal with the problems that it causes. But you can't take any medication or any operation or any radiotherapy or any chemotherapy or anything to get rid of HPV. But you obviously, the problems that it causes can be managed. So this is HPV. I hope you have understood what this HPV is. They cause 99% of all cases of this cancer of the cervix. So, what are the symptoms of cancer of the cervix? This cancer of the cervix may not show any symptom until it becomes invasive, until it gets to the point that you're not going to, it's not going to be curable again. It may show no symptom. That is the reason why you must undergo screening that I'm going to be talking about later, to be able to detect these problems when they are not showing symptoms. So not showing symptoms doesn't mean you're fine. It means you won't show any symptom, but it's progressing. And by the time you know it, you start having symptoms, it has gone to the stage where nothing much can be done about it again. So it's a disease that the earlier it's diagnosed, the higher the chances of of it being cured. And the progression. So I'm going to explain it very clearly. But it's a disease that goes through processes before it turns into cancer. It goes into processes. So what are the symptoms of this disease? What symptoms are? What are the problems you can have in your body as a woman that will make you at least suspect that you may have cancer of the cervix? Number one is what we call postcoital bleeding. Postcoital means after sex. So bleeding after sex. I'm not talking about when a woman is not lubricated and then somebody had their forceful sex and then there's a little bit of tear and then bleeding. That's not what I'm talking about. What I'm talking about is a woman who is lubricated, and then the sex is normal, and then after sex she starts bleeding. If you have that symptom, then suspect that you may, I'm not saying you must, suspect that you may have cancer of the cervix. So that's called postcoital bleeding. You can also have what we call intermenstrual bleeding. So what it means is that between your periods, you still bleed. So you have seen your period, and then maybe you're expecting your period in the next 4 weeks. 1 or 2 weeks later, you start bleeding. That's intermenstrual bleeding. That may suggest that you may have cancer of the cervix. You can also have what we call post-menopausal bleeding. What that means is that when a woman has attained menopause when they've stopped seeing their period. So it means that you don't expect that they will bleed again. So when you start bleeding after you have achieved menopause, it may be suggestive of cancer of the cervix. But let me just be clear that most of the cases of postmenopausal bleeding is caused by another cancer of the womb called endometrial cancer. So endometrial cancer is the commonest cause of that postmenopausal bleeding, but cancer of the cervix can also cause that. I hope I'm making sense. And then, apart from this postcoital, intermenstrual, postmenopausal bleeding, you may also have dyspareunia, deep dyspareunia. This means painful sex. Painful sex, when I say deep, there are two types of dyspareunia. Some people, the moment the penis touches their vagina, they start having pain. That's superficial dyspareunia. But there are some people that the pain is when the penetration is deep or after the withdrawal. So this is the kind of painful sex that you can have with cervical cancer. You can also have offensive vaginal discharge, very offensive smelling. You can have that. You can also have, pelvic pain, back pain, and so these are some of the symptoms. None of these symptoms is peculiar to cervical cancer, but if you have these symptoms, then you should suspect that something is wrong and should go for further intervention with your doctor and your gynecologist. So these are this. Then you can also have symptoms which are suggestive that this cancer has spread or has become advanced. Things like, being lethargic, being malaise, having malaise, constipation, weight loss, more vaginal bleeding, kidney pain, worsening of that dyspareunia, painful sex. These are, evidence that the infection may have spread more, So the symptoms would actually depend on the extent of the disease, but just be aware that you may not have symptoms. So the next thing to talk about is how can this disease, cancer of the cervix, be diagnosed? How can it be diagnosed? Obviously, the first thing is you having the symptoms that I mentioned. Then you go to your doctor. Then your doctor will do a vaginal examination. This time, the doctor will use what we call speculum. Speculum is a kind of small equipment that the doctor introduces into your vagina to expose your cervix so that they can see it. So the doctor will look at the cervix. The cervix may look normal, or you may have lesions or mass. If you have a lesion or a mass in the cervix that bleeds when they touch it, then that is suspicious of cancer of the cervix. So after that examination, and if there's suspicion, you can go for cervical cytology, which is like what you call cervical smear. So I'm going to talk about it in detail. And then if the cells are abnormal, if you do cervical smear, it is a kind of process where you go into the room where you're having the procedure, lie down on your back and face front and spread your leg. And then the operator, whoever that is doing it, will put that same speculum and then use a spatula or something and get it to your cervix, roll it, and take cells from there. And then that cells that, if they look abnormal, it can also, it can now be taken to the lab for them to have a look at it and see whether they are abnormal. Then if they are abnormal, you can also be referred for what we call colposcopy. Colposcopy is, let me explain, it's like using a microscope, a tiny microscope with a light at the tip. It will be passed through your vagina. It's not painful. And then the colposcopist is the person doing the procedure, will now look, and look at your cervix with the light at the end, and through a microscope. So they look at it. They can use that to also take cells from and tissue from your cervix and send in for biopsy. So the diagnosis, to diagnose it, apart from the symptom and examination, we can do colposcopy, cervical screening, and then biopsy. Obviously, all biopsies that they take it to the lab and check whether these are cancer. So these are basically the way to diagnose cancer of the cervix. So who are the people that are most at risk of developing cancer of the cervix. Let's just talk briefly. Who are the people who are most at risk? Women who are most at risk. One, smokers. I think the chances of a smoker developing is about 2 to 3 times more than a normal person. If you're using a contraceptive pill, the one we call combined oral contraceptive pill like microgynon, if you use it for up to 5 years, it is said that you have a risk of suffering from cervical cancer. People who started having sex early. If you started having sex early, then your chances of developing it is higher. Women who had babies very young also are at a higher risk. Women who have had more than 5 children are also at higher risk. Obviously, people with women with multiple sex partners are at higher risk. So these are the people that are, and then obviously people who are immunocompromised, or somebody who has had chemotherapy, somebody who is diabetic, or people who have immunological problems, that the immunity is low, HIV and all that, your chances are higher. So if you started having sex early, it's a problem. If you had baby too early, it's a problem. If you had more than 5 children, it's a problem. If you're a smoker, it's a problem. If you're using contraceptive pill for up to 5 years, it's a problem. If you have multiple sex partners, it's a problem. So these are the things that put you at a high risk. Okay. So the nitty-gritty of this talk is in prevention, because this is what I need you to pay more attention to. Because I don't expect you to treat it yourself, but you can do things to prevent it from happening. Apart from obviously using condom and not having babies early, or not having multiple sexual partners, there are 2 basic things you can do to prevent this cancer. 2 basic things, and very important. So if you pay attention to this aspect, then you will take something home. Sorry, let me just have a little fluid. So let's talk about vaccination. Vaccination, like as people are taking COVID vaccination. So you can take vaccination against the virus, human papilloma virus. So let me talk about this vaccination. Let me take UK, an organized society, as an example. Nigeria is jaga jaga. So let's talk about UK. UK has a program that every girl or boy who is between 12 and 13 years, is invited to have this vaccination at 12. And it is expected that at that age, that person hasn't become sexually active. So children, boys and girls who are not sexually active at the age of 12 and 13 are invited for this vaccination. So they have 2 vaccinations within 6 months. I mean, if you have the first one first day, you're invited for the second one between 6 months and 2 years. You come back and have the 2 vaccinations, and that's complete. This vaccination prevents you from having HPV, but it does not 100% prevent you from having the cancer. But if you don't have HPV, your chances of having the cancer is very little. Remember, I said about 99% of all cases of cancer of the cervix are caused by this virus. I didn't say 100%. So what it means is that even when you have the vaccination, your chances of having cancer of the cervix is still there, but it's very, very insignificant. So they are invited. So if you were not invited at that age, and then you came probably when you're 15, you can still have the vaccination, as long as you're not yet sexually active. Then you can have the vaccination 3 times this time, because 2 times will not be sufficient for people of this age and any age. So what happens is that if it's like my audience now, most of you are adults. If you're sexually active, chances are that you may already have that HPV. So if you already had the HPV, there is no need preventing it. If you want, if you want to have the vaccination, you need to go and have a test to check whether you have HPV. If you're not HPV positive, then you can have the vaccination. There is really not much gain being HPV positive and having the vaccination. So the vaccination is suited for people who don't have the infection. And it's believed that people who are not sexually active don't have the infection, since the infection is sexually transmitted. I don't know whether I'm making sense. So if any of you want to do the vaccination now, you need to go and check whether you have HPV. If you're not HPV positive, you go ahead and have the vaccination 3 times. And that would give you a lot of protection against this cancer. If you have children, boys, girls who are 12 and 13 years, who are not sexually active, you should do well and take them for the vaccination. That would reduce their chances of having HPV. And if you don't have HPV, your chances of having the cancer is very little. So I don't advise somebody who has had children or somebody, and then to go and do the vaccination unless they did the test and they were negative. Even though a school of thought says anybody that has the vaccination can have some protection, whether you have the disease or not, I don't know. But the vaccination is best suited for people who don't have the infection yet. People who are not sexually active. Because most people who are sexually active have the infection. And the infection can be in your body. So that's HPV vaccination. That's one of the ways of preventing cervical cancer. Since cervical cancer, 99% or thereabout of it are caused by the virus. So if you vaccinate against the virus, then you are vaccinating against the infection, the cancer. Simple. So that's number one. The second one that everybody here that's a woman must do is not, it is not an option. It is not, every single woman that is here, except if you're 80 years old or whatever, what I'm going to talk about the program, is the cervical screening program. Cervical screening program. You may have heard of pap smear, cervical smear, cervical cytology. I don't know which one you've heard of, but it is available in Nigeria. Before it used to be just pap cervical smear, but in the UK these days they do what we call cervical cytology. So, okay. In this country, with organized healthcare, there's a program known as cervical screening program. Cervical screening program. Let me explain the program. It also, in the UK, we have 4 countries: England, Wales, North Ireland, and Scotland. So they have different, their program is a little bit different depending on the country. But if you're in England, like as I am here, what they do in this country is that the moment you attain as a woman the age of 25, you will get an invitation through your door to come for the cervical screening. Every woman, without an exception. The moment that day you drop 25, your letter will come through your box, inviting you to come for cervical screening. So when you go for the cervical screening, what they do is they put you on their couch or their bed, whoever that is doing it, that is trained to do it, and they, like I explained it before, they will take the cells from your cervix after opening up with the speculum. So what we do in this country is, when they take that cell, they will send it to the lab to be looked under the microscope to see whether you have abnormal cells in the cervix. And at the same time, they will take some cells and go and check for HPV. So when they do the cervical cytology here, they are checking for abnormal cells in your cervix. They are checking for the abnormal cells in your cervix, as well as the HPV at the same time. So that's how they do it here. So if they take the cell and then the result comes back that there is no cancer cells or precancerous cells. Precancerous cells are these abnormal cells. Precancer is before cancer. So if the result comes back that the cells are normal and the HPV is negative, listen, if the result comes back and you are HPV negative and the cancer cells are normal, you will be called back for another one in 3 years' time. If you are between the ages of 25 and 49, that is the program in this country. If you are a woman between the ages of 25 and 49, you will be invited every 3 years for cervical screening, provided each of the screening you do come back with normal results. If you become older than 49, you will be invited every 5 years, between 50 and 64 years, as long as your results come back normal. After 65 years in this country, they stop doing the screening. You will only be screened after 65 if the last 3 smears you did before you attained 65, at least one of them was abnormal. They will invite you again. Or if for any reason you missed your screening when you were younger than 65. But if your last 3 screening before you attained 65 were all normal, you will not be invited again for cervical screening. This is the program. But if for any reason you did the screening, then it comes back that you have abnormal cells, depending on how bad it is. I don't want to confuse anybody here. We'll have mild, moderate, severe, what we call dyskaryosis. So that is the way cervical cancer happens. So if they do the screening, you may have little changes in your cervix. The cells may show little changes, what we call mild dyskaryosis, or what we call CIN1. That is cervical intraepithelial neoplasia 1. So these are pre-cancerous cells. They are not cancer, but they are things that are giving the idea that you could have a cancer, because cancer of the cervix progresses from that CIN1 to CIN2 to CIN3 before it becomes pre-invasive and invasive. And do you understand? So it's a slow progressive. So when you do the test, the cervical screening, and the result comes back that you have abnormal cells, you can be treated at that point in time, no matter how bad the cells, no matter how bad the abnormality is. So if, for example, the cells come back, the result comes back, and they say you have abnormality, depending on how bad, you can be invited again in the next 6 months to repeat it. And if it's still abnormal, or if the abnormality they saw in the cell is quite a lot, you'll be referred for that colposcopy, which is, like I explained before, the process whereby they use that microscope with light at the end to look at your cervix to see how it is. They will see it. If it looks abnormal, if it looks abnormal, they'll refer you straight to a cancer specialist. If it looks abnormal with all those lesions, they will refer you straight to an oncologist, a cancer oncologist, gynecological oncologist. If not, you will do your colposcopy, they will take biopsy and send to the lab. You can even have the cancer cells treated during the colposcopy. So the essence of the screening is to detect these pre-cancerous cells, these abnormal cells that have not become cancer. So when you do the cervical screening, the result will come back to say, oh, Miss John, whatever has mild dyskaryosis, there are some abnormal cells, or it has moderate, it has severe dyskaryosis. All these things are not cancer. They are pre-cancerous cells, and they are 100% treatable and curable. So it is when you do this cervical screening that all these things that I'm talking about can be detected and be treated. But if you don't do the screening and you have, for example, the CIN1, cervical intraepithelial neoplasia, the mild one, and you just don't know, no symptom, and you're moving about your normal business, chasing your hustle and bustle, it progresses to CIN2, and you're going about your business, it progresses to CIN3, and you're going about your normal business, and it progresses to invasive cancer. And that's where die don't come with that. But if you are following the cervical screening program, going every 3 years, that's UK. Some countries do it every year. Some countries do it every 2 years, depending. But this UK is 3 years for women between, not UK, England, because Wales starts at 20. I think Scotland starts at 20 as well, but England starts at 25 till 65. Do you understand? So, but if you're in Nigeria, nobody's inviting you, you should invite yourself. So there is no woman here now who is listening to me who should not go for cervical screening if they have not gone for it in the last 1 or 2 years. And the reason why you only go for 2-3 years is if the one you did last 2-3 years came back normal. Because if it didn't come back normal, they would have to invite you again and do it again and again. And if it's severe or moderate or something, you will go for colposcopy and you may go have treatment right away, and it's 100% treatable. If it's so bad, you may have surgery. They might remove the womb, hysterectomy, if it's so bad. Because it's better to remove the womb than to allow you to progress to cancer that would kill. So when it becomes an invasive cancer, it wouldn't be able to, it's no longer amenable to treatment. You can have treatment, radiotherapy, chemotherapy, surgical and everything, but still, it's too late. But if you do the cervical screening regularly, every 2 years, it is available in, when I was in Uniben, as far back as I entered Uniben in 1984 and left 1990, 91, we had it then. So it's available in Benin, it's available in Port Harcourt it's available in Lagos. It's not something that is rocket science that you have to start looking for it everywhere. I don't know how much it costs, but I don't think it costs arm and leg. It is one investigation, that one thing any woman should do for themselves. Go and have your cervical screening and know whether your cervical cells, the cells in your cervix are normal, or are they already progressing to cancer, so that you can nip it in the bud and cure it and not have the cancer. This is what I want you to take home today. If you have children who are 12, 13 years who are not sexually active and you can afford it, please send them for HPV vaccination. I don't want you to, somebody who has had children or who has been having sex all through their life, I'm not going to be advising you to rush and have HPV. It might not do much for you, the vaccination. It may not do much for you. It's only when you're you haven't been sexually active, or you did a HPV and it came back negative, that you can go for the vaccination. But the vaccination on its own would not prevent you from having cancer. So you will combine the vaccination with this cervical screening. So if you've had the vaccination and you do your screening every 3 years, you will almost never develop that cancer. It is almost impossible for you to slip through the net that you had the vaccination, you did the screening and it's negative, everything is normal. They call every 3 years. They call you. It is almost impossible. Nothing is impossible in life, but it's almost impossible that if you're diligent with your screening, you will have cancer of the cervix. So one good thing about this cancer of the cervix is that it's something that can be detected very early and treated. And the procedure for detection, that cervical screening, is not an invasive. It's not an operation where you have to open up your womb or make a hole in your tummy, laparoscopy and do whatever. It is just lie down, put your legs apart, speculum, small speculum into your vagina. They open it and take cells, and they send it to the lab. A couple of 1 week, 2 weeks, or 3 weeks, the result is back, and then you know your status. Oh, okay, all right. There are no cancer cells, there are no abnormal cells, and I'm HPV negative. Then you can go back to your normal business. 3 years time, you go back again. 2 years time, depending on your affordability, if you're in Nigeria, or such places, you go and do it. You have to keep doing it. You don't have to do it yearly, but at least every 2 to 3 years. If you're between 20 and 50. If you're above that, you do it every 3 to 5 years. Just go and do it and it on. Because the cervical cancer is a major killer. Why do you want to die from a disease that you can prevent same easily. It is not as expensive as a lot of the wigs and weave-ons that our women wear. I'm 100% certain that it's not as expensive as that. So it is a lifesaver, cervical screening. If you did not know about it today, take that home tomorrow, find out where they do cervical smear or cervical cytology, pap smear, any of them, where you are, and that would save your life. When the result comes back, oh, you can tell me, Dr. Chin, I've done the test, though, everything is normal. I said, okay, I'll remind you in 3 years' time, go back. So these are the, the prevention basically are the things, the preventive measures, apart from the condom and, you can't, somebody who has started having sex already at 12, I'm not going to start telling the person that to go and, obviously. So, but things that you can help are the vaccination and the screening. And obviously use condom, when you have sex. That is if you already don't have the infection. Because if you already have the infection, the condom is not going to cure the one you already have. The HPV doesn't have a cure. So remember, this cancer does not just develop like that. It progresses over the years, stage 1, stage 2, stage 3, like that. So you have all the chances to pick it at those stages of development. I don't know whether you understand what I'm saying. So if you do this smear and it's stage 1 or stage 2 or stage 3 of CIN, you'll be treated. Nothing major, unless it's so bad that you may have surgery or even radiotherapy with it, depending on how bad the changes are. So you do these things to prevent these abnormal cells from developing into a full-blown invasive cancer. Am I communicating? I have not even been reading. I hope all these things I've been saying, people have been hearing and understanding it. So HPV is not a female disease alone. It also affects the men. That is why in this country that I am, boys of 12 to 13 years are also invited for the vaccination. But obviously they can't go for cervical screening eventually, but they go for the vaccination to prevent them from having cancer of the penis, cancer of the throat, and cancer of the mouth. This virus, I've never seen a virus that causes so much cancer. One virus that you get through sex. Cause cancer of the penis, cancer of the vulva, cancer of the cervix, cancer of the vagina, cancer of the mouth, cancer of the throat. One virus that you can prevent. My people, I think I've said what I want to say, and I just hope you heard me and you take this home. I don't want to go into the details of when you now have the cancer. Obviously, when you have the cancer, they're going to the full-blown cancer treatment is surgery, chemotherapy, radiotherapy, or all of them. But is it going to cure you? Unlikely. Make hay while the sun shines. This is one condition that you can safely say a stitch in time saves 9. Emengwangwa, Emarodochi, in Igbo, sorry. But that's the same thing as a stitch in time saves 9. Okay, ladies and gentlemen, thank you. I've been rambling. I will go through your questions and your comments and respond back. Okay? I will be heartbroken if people didn't understand me, because I try to make it as simple as I can in simple English. So I'm looking for questions, Let's see. I hope nobody will ask me what is cervical screening here. Or what is vaccination. Yes, well, we are used to the word service. You may be shocked. Some people don't know where this service is. They probably think it's in the neck. The video no gree play. Somebody said that. So how come you were able to? Yeah, okay, Fola. I haven't seen any questions. Fola is just summarizing my I think I should return to Nigeria and be a lecturer, you know. There's so much to teach in Nigeria. I believe the infection is one. What's that? Victor Duru said, I believe the infection is one. I don't know what you mean, my brother. Olebube. Hello? Victor, yes. Human papillomavirus, HPV. Christian Akbar, yes. Sexually transmitted infection. It is what it is. So, I see. Miracle Salas, why is it more in the ladies of 20s? I didn't say it's more in the ladies of 20s. At least you can watch, even if you can't post. You know, half bread is better than nothing. So I haven't seen any question, to be honest. It can cause other cancer, e.g. cancer of the throat, lungs. Yet it can't be cured. The virus, yes, Genevieve, yes, you're right. You can't say, let me go and take medication for HPV. So everybody should run and go and do cervical screening, pap smear or cervical smear, or whichever one is available. Yeah, Fola, you're getting me, as usual. Early detection gives higher chances of curation. Absolutely spot on. Then Fola listed the symptoms of cervical cancer when it does have symptoms. I wish all diseases would just have symptoms, show symptoms as soon as they show up, but some of them will just hide in your body for years and be causing havoc. I don't know why. Genevieve, postcoital bleeding, intermenstrual bleeding, postmenopausal. Yes, I suspect that, Genevieve, you are in the medical line because you can spell these things correctly. You know, very few people can spell coital or menopausal. Yeah. Yes. Chima, so is that painful cells that you picked of all the things I listed? Deep dyspareunia. That's the only one you picked. Wow. Pelvic pain. Olebube has itemized like, yes, good students. Olebube and Fola, they are good students. So I'll give them first class. Why is it more in women than men? Somebody asked me that. Oh God, I shouldn't laugh. Who asked me that question? Oh, sorry, Naji Doris. Men don't have cervix. Sorry. Oh my God, you cracked me up. Men don't have cervix. It's like when I'm discussing cancer of the penis and you ask me why is it more common in men? Do women have penis? UK, yes, I'm fine, thank you. And yourself? Knowledge is power. Okay, I haven't seen any questions so far. I haven't seen any question. Christabel Oluchi, my first time of being here. There's always a first time there. Vivian, okay, I said I am late. I will save it, and you can watch it later. Cervical, Siri is not cervical psychology. It's cervical cytology. I'll spell it for you. C for chain or for Charlie, Y for Yankee, T for Tango, O for Oscar, L for Lima, O for Oscar, G for Golf, Y for Yankee. Cytology, not psychology. Genevieve, I would like you to tell me what you do, because the way you spell these things, the speculum, you can spell it correctly. If I say Sims or Costco speculum, I'm sure you're going to spell it correctly as well. So that gives me the impression that you are not a JJC in this, like the smart Falan Olebube who are not in the medical line, but they are following. Cervical smell, Ngozi Edna, what the hell is cervical smell? I said offensive vaginal discharge. I didn't say cervical smell. Offensive smelling cervical vaginal discharge. You know what vagina is and you know what discharge is. So I don't need to break that down and be graphic. If you want to, how you doing? Yes. Chima. You're here to Ego Dimpa. How you doing? There's nothing more. There is nothing more. I'm not missing anything. Let me see. Diagnosis. Yep. Cytoscopy. Yeah, you see, that's the difference between Olebube, who's doing so well, and that Genevieve. The way the Genevieve spells it tells me that, I think I don't know whether it's colposcopy, as Olebube was trying to spell their colposcopy, C-O-L-P, colpo, O-S, then C-O-P-Y, colposcopy. Yes, the ones are high risk: early sex starters, early childbirth, more than 5 kids, smokers, multiple sex partners, immunocompromised, women that use contraceptive pills, the ones we call combined oral contraceptive pills for more than 5 years. These are the people who are at risk. That doesn't mean that any other person can't have it, but these people have more risk, if you get what I mean. Tochi, having baby at 20 is not early. It's not early. I've seen a woman who is 40 and she's a great grandmother. She's a great grandmother. Not even grandmother. She's either grandmother, no, not grandmother, of course. Great grandmother at 40. Yeah. So that's what I mean. That family, the woman, her daughter gave birth at 12 or 13. The granddaughter gave birth at 12 or 13, like that. I don't know whether that's what they inherited. Oh my God, Ngozi Edna, who are you advising here? I don't think there's any child here on this forum now. This one doesn't make sense. Yeah, smokers should stop smoking. They should stop smoking. It's one dangerous habit. Nkechi Okonkwo. All these people that when you announce that you're going to have next children, say, noted, noted. When the time comes, you're not going to see them. The noted team. You know, if I were them, to be honest with you, I would always want to learn, because all these conditions have very serious public health significance. You know, so I can't see any question, to be honest. Maybe when I save it, I can go on and look for, you know, if you don't get money, so sorry. I don't. So, can a girl child catch this before 12 or 13? If she's sexually active, only if she's having sex, yes. Straightforward answer. If you're having sex, you can have it. Because the vaccination is not dangerous. Why is the vaccination dangerous? Are you... Maybe you mixed things up? How can vaccination be? She might say, I'll go and do the test. You're just kidding. You're just messing about. Yes, Fola, you asked, the girls between 12 or 13 that are sexually active can go for the vaccination. Spot on, yes. Because they won't have the infection, so they're going to go prevent it. But the essence of vaccination is to prevent an infection, isn't it? That's why you do vaccination, to prevent the infection. Ella, are you asking me what sexually active means, or you were just being rhetorical? People who are not sexually active can go for vaccination, yes. Doc, how can we prevent it? I'm not sure when you asked this question. I hope you didn't ask the question after I spoke at length about prevention. I hope you didn't. Because if you did, I'll be heartbroken. Yes, Nigeria jaga jaga. You can't fault me at that, can you? Nigeria jaga jaga. See the way this country has several programs for their citizens. They have cervical screening, they have bowel screening one, they have the ovarian cancer one, they have the endometrial cancer one, they have the breast cancer one. And you know, you don't even need to do anything. You just be at home lying down, and the postman will bring a letter and inviting you to come and telling you where to go to have this screening. And you won't pay a dime. Nothing. You pay nothing. You go and have this screening. You pay nothing. So, very organized countries. You know, there's a certain age I will attend now, they will send me a letter for bowel screening. You know, so I go to screen and see whether I have any risk of bowel cancer. You know, they do a lot of things for people in this country, for them to stay healthy. One area miracle, abnormal cells, precancerous cells, to be detected in cervix. Yes, absolutely correct. So, I think we're going to be coming to an end now. This program will be coming to an end if I'm not seeing anything more. Ella Bob, you were the one that said that you want this thing to go on for 5 hours because you got data from Marco. Yes, I remember reading it. And I can see you here, fully participating. Don't worry. Next session, in fact, the next 2 sessions, remind me, I will pay for your data. So you're not one of those that collect data and disappear. At least you collected data and you're here participating. So I will provide you data for the next 2 sessions or even more. Oh my God. But what is scaring you? Huh? it's better you go and do your cervical screening. Does breast cancer? I mean, unless there's no direct relationship between breast cancer and cervical cancer. Breast is breast. Unless there's I don't know, even metastasis is not gonna be able to spread from the breast to the cervix. No, I doubt it. Is there a relationship between fibroid and cervical cancer? Chi? Absolutely none. The kind of cancer that fibroid can cause is what we call fibrosarcoma. It's a kind of, and it is very rare, very, very rare for fibroid to cause cancer. But it can cause cancer. I don't think it's even up to, I think it's less than 1%. Less than 1%. So, but there is no relationship between fibroid and cervical cancer. Absolutely nothing. Can infection, somebody asked me, please sir, can infection lead to cervical cancer? How do I answer this question? After all this talk. So what is HPV? Is HPV not an infection? HPV is not a car, my darling. Or I think it's a woman. It's not a car, it's an infection. I don't mean to be rude, but it's a bit frustrating. Yes? Remove womb? Yes? What's your name? Elabo? There are several conditions where you have to, a woman's womb is taken off. Even ordinary fibroid. If you have fibroid and you're having so much symptoms like bleeding, you're bleeding so much that you complete that the treatment is to remove the person's womb. There are several conditions where the woman's womb can be removed, to save their life. What do you need the womb for if you're not going to be alive? Do dead people have womb? Do dead people have children? Patrick, you feel sorry for the women. Why? The men also have their own burden, One day miracle, yes, it can be treated. Christiana, can cancer cause sore in the womb? Can cancer cause sore? Of course. Can cause sore in the womb. A cancer, I don't know which cancer. Cancer of the womb can obviously cause sore in the womb. At least I'm happy that everybody, even those that are joking, understood that cervical screening is the way forward. It's the way forward. If you haven't done it and you're there going to the market to buy shoes or buying weave on, or then you hate yourself. But you did it. How long ago did you do it? If it was negative, like you said, and it's less than 3 years, and then you can wait to save the money for 3 years from when you did it. I don't know how much it costs, but does it cost much? I think it depends on the center where you're doing it. If you're doing it in a government hospital, it's going to be cheaper than when you're doing it in a private hospital. If you're doing it in VI, it's not going to be the same thing as when you're doing it in Oshodi. You know what I mean? If you're doing it over, it's not going to be the same price as when you're doing it in Maitama. You know the way Nigeria is. You get my point. But if you come to the UK, you don't pay nothing. They look after you. You don't pay a dime. You have all this screening. You don't pay a dime. And you don't even apply. In fact, on the day you attain that age, you just see the letter come through the post box. Bam! You have been invited for this and that. You should go there at so time. All you need to do is to take yourself there. And if you're one of those that don't work or benefit, you even have money to take cab and come. Or I mean, not cab, whatever. You come with bus or train. Just bring yourself and take yourself home. Nothing. In fact, go better for our leaders. That's why sometimes if I consider throwing away my British passport, I remember that, oh my God, Naija jaga jaga. Nigeria, just keep this your British passport. That's their mama. You never know. Even though I'm a proud Nigerian. Okay. All right. What is the time? Oh, it's just 8 o'clock here. Oh. So, 8 o'clock here. So the lecture was we've been on for just an hour. That's all right. I can play for another 15 minutes before I disappear. Yes. I can understand that most people understood the lecture, yeah? And so that's why I don't have a barrage of questions. Yes, Linda, early detection is key. Sine qua non. Early detection, well, you know, that's why a lot of our people are dying, and you know, these days, before you see somebody that died of cervical cancer in the UK, they still die, but it's rare. But oh my God, a lot of Nigerian women, have that cancer and they're dying from it, and it's something that can be prevented. I don't know why I can't become the president of Nigeria and make changes. They won't allow people like us to win in political elections in Nigeria. So that's why I will never delve into it. I wish I could just close my eyes now and they take me to Aso Rock and say, you're the president of Nigeria. No election, no. Just be there. Honestly, for 4 years, if I don't, oh my God, I don't know. I don't know whether there's a juju there that affects them, that makes them not to know. When they come to this country, they see all these good things, and you think that when they go back, they will translate it over there, but they will go back and just chop the money. Can men also go for the scan? Siri, which scan? I didn't say anything about the scan. Not at all. I said cervical screening. It's through the woman's vagina into your cervix. Unless the man is a bisexual, or hermaphrodite. Yeah, that means you have both the male and female. Intersex. It's called intersex or hermaphrodite. You have both the female and the male organ. Then the person can go for the screening. But if you're a full-blown man, then, or you're not a trans woman who has changed from man to woman and had all the operation, when you're moving transing from man to woman, they can do operation to remove your penis. They do operation, remove your penis, fashion a new vagina for you, give you vagina, give you vulva, to put all those things for you. Then you can even, but they won't be able to give you womb, unfortunately. But they can give you all that and make you look like a woman, isn't it? So you will now go for those screening. So, okay, the lecture is over. How can we go for HPV tests? Go to your hospital and ask. If you are in the UK, I'll tell you how. But in Nigeria, just go to your hospital and ask. Chima, pregnant woman that has HPV, does it affect the unborn child? No. HPV in itself, unless, if you have symptoms already, if it has caused you problems already, like genital warts or cancer or another, it's not an infection that can spread from mother to baby. It's not an infection. Apart from, it's not that, except genital wart. And genital wart is just like a wart in the outside of your anus or vagina, clitoris, penis. That's where you can have all those warts. Those like fleshy thing. Usually not dangerous. Can it be treated before you get to cancer? I answered the question. Can't keep answering myself, repeating myself. Daddy, is there any vaccine that one can take to prevent all sicknesses in the world? I wish. I wish. Me, I'll be the first person taking it. Even before I tell you about it, I have taken it. My wife has taken it. My children have taken it. Oh my God. What are the symptoms? Okay, you probably joined late. I assume you did. Yeah. Ngozi Edna, you didn't join late, but you're asking me how to prevent it. Is there any medicine to take? You didn't join late. So I think you better go back and watch the video. There's no point please, during time of delivery, the hand the doctors normally put to check the CM progression, does it affect the woman's cervix? No, it doesn't. You just put hand in through your vagina into the cervix and assess the dilatation, how far the cervix has opened. Because if it hasn't opened up to 10 cm, they will not do. You're not gonna have the baby come out. So we'll have to. The essence of that is to assess the progress of labor. As your labor is progressing, your cervix is dilating. When it's 10 cm, that means it's fully dilated. Then they can ask you to push at that point in time. Yeah. Can someone with HPV be able to give birth? Of course, it doesn't cause infertility. Cervical screw, how much can it cost? I wish I knew. Don't worry. Yes, I was going to say this thing that Nwachukwu said. If it's possible, I would appeal to you to open a screening center. I was going to say that now, that I will look towards that. I will look at that, then I read it. It's not when I do it now you say you are the one that motivated me. It didn't in my brain. Or you did my brain. Okay. Yes, Ole, your top fan is back. I'm happy for you. I was waiting for you to come back before we, because I could not afford to give out that phone without my people being, you know what I'm saying now. And I think Fola's own is back too. Chima used to be a top fan. He has lost his top fan badge. He's now a sharer. He's lost it as well. Oh my God. Okay. My people. It's time to... Yes. Susan Boyle. It's not what I want. What the fuck? I don't want Susan Boyle. To post. Meanwhile, the man is the one that his sperm is not healthy, or they are not bringing it up, or their sperm is when they ejaculate, the sperm, instead of going forward, the sperm is going back into their belly. So I'm going to be talking about that next time. All right, guys. Thank you. God bless.